Hi, my name is Ashley Reid, and I'm going to give you a hip mobility workout. So during and after pregnancy, that's the most common complaint I hear from moms and moms-to-be here in the Active Mom Fitness Studio. So let's take about 8 minutes to loosen up those hips. The first thing you'll need to do is sit where your knees and hips are about equal height. And then I like to use a placeholder here. You're not putting any pressure into this yoga block. You can also use a throw pillow or anything that kind of keeps your knees about hip distance apart. And the goal with this is to rotate through the hip. So your hip is a ball and socket joint, and you want to picture it rotating. So notice I'm only lifting up as high as I can go without having to lean. So it should be gentle and get as much rotation as you can. If you'd like to incorporate the breathing, I am exhaling as I lift. We're just going to do 2 more on this side. Good. And then we're just going to switch to the other side. Same thing. So it's not uncommon to feel that one side has more mobility than the other, which is why I like to do single-sided exercises every now and then so that we make sure we're not compensating anywhere. Good. So a lot of the hip tightness comes from the difference in maybe activity level while you're pregnant or after pregnancy. It comes from the anatomical changes. So a lot of times I'll hear that during sleep is when you feel it most. So you're playing around with pillows and that type of thing. So it's actually not a bad idea to go through these exercises before you go to bed at the end of a long day, especially if you've been sitting a lot. We have 1 more here. All right, and then we're going to set the block aside. You're going to go ahead and cross one leg over. Now with this stretch, I like to kind of flex my foot to protect the knee, and I'm not leaning over. I am keeping my back flat, chest up, and I'm kind of pressing my belly button towards my calf muscle and then letting it release. If you're really tight there, you can breathe through it with that exhale as you're going forward, and we'll go 2 and 1. All right, we're going to go ahead and switch to the other side. Same thing. Remember, you're not rounding. You're kind of just giving that gentle push through the hips, so you should be feeling that stretch right there. Now, I'm doing right and left sides back to back, but another way to do this program is to do the right side with all of the exercises and then the left side with all of the exercises if you need more repetitions for each. So for example, you could have stayed on the same side with this. So if you need more, want that longer program, that longer mobility flow, feel free to do it that way, and then you just repeat the video on the other side. All right, so then we are going to go into a hip flexor stretch. So you're going to go ahead and stand. You're going to tuck the tailbone under, so a little pelvic tilt. And again, I'm kind of just pressing my hips forward here. So I'm feeling that lengthening in here. And then we're going to press them backwards. So we're going to get both directions. Here you'll get that front hamstring. This way, back hip flexor. So press and come up and press and come up. And then let's just go ahead and switch to the other side. Same thing here. Tuck the tailbone first, pelvic tilt. Keep that pressure. That's what's going to stretch that back hip flexor. And then you hinge. And then you come up. And then you hinge. And we'll get 1 or 2 more here. Good. And then we're going to do another standing stretch. So you're going to take one leg behind the other. And I'm going to stick my hip out to the side of that back leg with the reach. So I'm going to reach and pull. Reach and pull. We're going to go 3, 2, and 1. And then we're going to go ahead, switch to the other side. So again, cross that leg. I can almost give a little press of my hips and then lengthen even more with that reach. So you'll notice the stretching in here, which can feel really good. Again, like if you're sitting a lot or have the weight of a baby there, these muscles around here can get really shortened. And then we'll get 1 more in. And then we're going to go to a really basic one, hip circles. So you may have done these before. I like to do them with my feet together, which intensifies it. And so with this, you want to make sure you're focusing on moving the lower body and not just moving through the upper body. So you really need to exaggerate the movement. All right, other direction. Good. And we'll go 2 and 1. And then from here, we're actually going to go down to the ground, and we are going to go a little bit with the inner thigh here. So that could get really tight during and after pregnancy. I'm going to have my heel on the ground. This is another one where I'm going to sit back, but I'm not bending forward. You're not rounding. So chest is up, sink back into that heel. My back foot is flexed, and then I come up. And you can play around with how you like your foot positioned. Some people like it flat, where you're kind of keeping the outside of that foot down. It gets a little bit different area. So you do what works for you. I will say, if you start to get some separation or pubic symphysis pain, this one you may not like the wide stance since it's separating the legs. So if you're getting that pain, please don't push through it. We have one more. Good. And then we'll go to the other sides. I'm just going to shift this. And here we go. Same thing. Sink it back and come up. Good. And again, one side might be a little tighter than the other. Often really tight inner thighs. If you also have a tight pelvic floor, that can be connected. So it's nice to be able to lengthen these muscles. And we'll get one more in. And then lastly, we're going to go from kneeling. Again, you want your knees kind of close together. And you're going to press and then reach. So we're going to open up through the sides again. Good. And we'll just get one more each side. All right. Okay, so that is a hip mobility.